welcome and thank you for joining Tim, Juliet and I. Unfortunately, the chairman sends his apologies. He's between one thing and another with his permanent role at Alder Hay and the work that he's doing here. So he was torn and he gives his apologies, sends his apologies. I was told actually at the Kendall briefings that not to assume everybody knows who I am. So, and I think that's a good point. I'm Jackie Daniel, I'm the Chief Executive. I'm joined by Juliet Walters, our Chief Operating Officer, and Tim Bennett, Director of Finance. I decided not to do a slideshow. Some of you may be really disappointed with that, but just really wanted to talk to you about where we're at in our journey. And what I'm going to do is try and set the scene. And my biggest task really, I think, at the moment is trying to put together, and I use the word story, that's not meant to be kind of a derogatory put down, but it is important to put together a sort of narrative, and I call it a story, of where we are and where we're going, so that not just staff can understand, so that we can relay that same story to our public, to our partners and the people that are working with us. So I see that as one of my big challenges at the moment, because we've got a lot going on. And actually to try and just make that really simple for people and straightforward so that people can really understand what they need to do to contribute to it is quite challenging. So here goes, I'm going to test it with you. And then what I think we should do is just unpack the big ticket items in that. So we're going to have to talk for a little while about money this morning. And I also want to talk to you about quality and about some of the sort of day-to-day deliverables which Juliet will pick up on. So where are we? Well, I'm talking about things now in three phases. I'm talking about things by means of stabilising things, so that's the first phase. I'm talking about transition, which is the second and the middle phase, and I'm talking about transformation, which is the phase we all desperately want to get to, which comes at the end of those first two. So I think I'm sure we're still in the stabilisation phase. I think we've been in it for a good 6 months, and we're going to be in it until the end of March in the early new year. And why am I talking about stabilisation? Well, we've got one or two things we need to really get clicked into place in order to provide that platform for transition. The first thing is quality. And I was really, really delighted when the Care Quality Commission came back in unannounced, so it's not something we can even prepare for. They came in to look at our maternity services, and more recently they've been in to look at our emergency department and emergency care pathways. And you'll have heard the announcements. It was fantastic. It's nothing I'm doing. It's all about what you're doing. But they actually found that we'd met all their key standards. So we're compliant with where we should be. Now, that was brilliant. I don't know about you. I didn't pop any champagne corks after that announcement. And that's not because we haven't done wonderful things in complying with those standards, but actually that we've got a whole lot more to do. Because I don't know about you, but I've never been one for just meeting the grade. I always want to do a bit better. And for us and our patients, I want us to be doing. I don't just want us to be meeting core standards. I actually want us to be exceeding those. So I think we've got a lot more to do. My prediction is that the Care Quality Commission will come back in again to look at our emergency care pathways, probably some point after Christmas. We don't know when they'll come in, but I think we ought to plan and expect that they will come back in and have another look to make sure things are holding and that we remain compliant. We've been working on a number of other quality issues, or you have, and some of my team have. So we've been looking at, for example, our mortality rates, something that's measured annually for the NHS as a whole. Dr. Foster, a company you may have heard about, is heavily engaged in publishing those mortality figures. And I think, they're important, aren't they? Not just as a marker for how we're doing, but, about staff and public confidence about what outcomes we're getting as a result of the care that we're delivering. So I'm sure that I'm not sure what you thought about the Panorama programme that was on recently, that we featured on. But one of the good things that it said about us was that actually this year we are about where we'd expect to be. We are meeting those standards. So that's good. We're doing a lot of work around things like stroke care. And again, you'll be familiar with this. We've opened new beds in order to provide the right care for patients in the right place by the right staff. And I know there's quite a range of people that are working really, really hard so that we comply with making sure that people who do suffer from strokes get the right treatment and care at the point they need it by the right professional. So that's going really well. I'm sure that we won't start and end a conversation like this without talking about things like records. I'm really pleased with the work that we've been doing around outpatient services with the new booking hubs. It's really early days in terms of how that's working out, but we've certainly seen some improvements there. So until we've got to the end of March with all of that, all those quality things sticking and remaining in place, I don't think we'll have got beyond stabilisation. But there's a couple of other elements that we need to talk about in that stabilisation phase. The second one is clinical strategy. And as you probably know, we're doing some real thinking together internally. We're about to have some really important conversations with GPs and our clinical commissioning groups in order to really look at what do services need to look like, not just in the next year or two, but beyond that, into the next 3 to 5 years. Now, this gives us a massive opportunity to look at, well, what about those things that are perhaps not working well? What about, services that we're struggling to sustain for whatever reason? What about the opportunities that we might have if we do things differently? All of those things are up for grabs. We've been talking about, that nothing's ruled in, nothing's ruled out of those discussions. And by the end of March, we will have sight with our commissioners of some of those options. Now, we won't be making decisions in this period between now and March, but what we do hope to do is generate some options for discussion. And I think it's important we do get to that point by the end of March. So that's the second area. So we've talked about quality and we've talked about clinical strategy. The third area in terms of stabilising our future is around money. And we have been in a difficult place partly because of the need to improve our ratings with our regulators and deal with some of those quality issues, but we've spent more money than we've got, basically, and we're now in a negative equity situation, or negative, we're in a deficit situation as we approach the year end. What we now need to do is think through how we get out of that. And we can't do that without securing some support from the Department of Health, from the centre. And we're in the process of doing that. Tim might want to say a bit more in a few minutes. But we anticipate that we will have done that. We will have secured some short-term financial support by the end of March. So that's the third important sort of leg of this stool to get us where we need to be in terms of stabilisation. I'll pause for breath for a minute. So that's all happening between now and the end of March. Not a long time, I think you'll agree. It'll be here before we know it. We'll be out the other side of winter and looking at spring, and hopefully all those things will be in place. At that point, so on 1st of April 2013, next year, we enter what I'm calling our transition phase. Now, this is going to be probably the busiest phase that we've had in a long time, and I could kind of wait for the sigh and the, oh my goodness me, what does that mean? Well, that means actually thinking through when we've got sight of all the options for the strategy, which we'll have by the end of March, really working through engaging with staff, engaging with the public, engaging with MPs, anybody that will listen and will engage with us on, okay then, what do we think the options might be? What do we think the shape of services across Morecambe Bay should be over the next 5 years, 10 years and beyond that? And of course, once we've decided that, we've then got to think, well, what do the buildings need to look like to support that? Will we need the same configuration on each of our sites as we've got now? Will the Royal Lancaster Infirmary site look like it does now? Probably not, but what should it look like? We will need to think about, so what workforce do we need to deliver that? If we're changing pathways of care, are there new opportunities for ways in which professionals work, the way in which we get organised to deliver? Do we need to think about how we educate and train people differently to prepare people for that point in time? So our education and training strategy will need to be developed. Our estate strategy will need to be developed. Things like our information management and technology strategy, what we do to support the services, will need to be developed. So quite a busy time putting plans together. That's really what the transition phase is going to look like. Building the plans to make sure that in another 5 years, in another 10 years, we're not right back where we've been. Because you know, if there's a legacy I want to leave, it's we'd never go back there. You know, some of the things that some of the issues and problems that we've had, as I've said many times, have not been new. They've been visible for decades. And actually, we've got an opportunity now to put that right. So quite a tall order, though. And if you can imagine, I mean, they're all calls. It gets quite confusing for staff because we talk about clinical strategy, research and development, education and training strategies, workforce strategies. People think, you know, what are all these strategies about? Actually, all of those things really just underpin the clinical strategy. They're all just enablers to make sure we've got all the building blocks in place to be able to deliver that strategy. So that's the second phase. Now the third phase is what we're really looking forward to, which is when do we start to implement some of the things we're talking about now? When does it become a reality? And that, I think, will only happen from April 2014 onwards, because I think we're going to have a year where we're busy actually thinking through the detail of what those plans need to look like. And it will take us that long. I mean, it sounds a long time. And that doesn't mean that things will stand still during that year, because we've already talked about some things that we're improving as we go. And there's a lot to go at here. So things will improve during that time. But I think the real transformation will only start to happen from April 2014. And that's got to be a transformation that we've got to agree with the commissioners who are now, as you'll know, hold the money and decide what is bought where and when. So quite a challenging time. I guess a few other kind of short-term housekeeping things about what we need to do to get prepared for that. And then I think I'll pause and ask Tim first of all, and then Juliet, whether they've got anything to add to that. So a few sort of housekeeping things, a bit of stuff, if you like, to kind of lighten this presentation. We are interviewing for a permanent chairman on Friday. Some of you, I hope, have been involved in some stakeholder focus groups last week to contribute to that process. The interim chairman, Sir David Henshaw, and I keep smiling and positive and saying we are confident that this time we will appoint. And this will be an important appointment for us. I'm sure we will appoint. So news about that as quickly as we can get that out. Probably early to mid-point next week. The other thing that we're doing at the moment, you'll have probably seen, some of you that read some of the NHS press, we're out to advertise for a Director of Workforce and a new post, which is a Director of Governance. Probably not, you'll not be surprised to see the latter post being put in place. It's going to be really, really important. That person's going to really make sure that the whole of the board assurance framework, all our processes around risk and governance are held together. And I think we need sort of some top level expertise in order to help us make sure we don't get into the place that we've been. So I'm hoping that we will have recruited by the end of January, and at that point we'll have a full board and a full executive team, and we're ready to good to go, as they say.